Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Okay, it's not too far in. Okay. All right, Carlos, tell me what's going on with your elbow. What happened?
I started feeling pain in my inner elbow after doing pull-ups.
Okay. So how long has it been going on?
About 2 months.
2 months. So you did pull-ups and you injured your elbow. What kind of treatment you had for your elbow?
I saw a physical therapist. He asked me
Mm-hmm.
to do exercises, kind of
Mm-hmm.
push against my hand,
Mm-hmm.
and it stretch it like
Okay.
this.
Okay.
That's it.
So, what kind of motion aggravate your symptoms? Because we want to use those motions for way to reevaluate your response to
Yeah.
the treatment.
So when I twist, especially like this
Mm-hmm.
sideways,
Okay.
I feel it right here, probably about a 6 in pain.
Okay.
When I go like this, I feel it less, about a 3.
Okay.
Yeah.
So how does that feel from 0 to 10?
Well, it's like a 1.
Okay. So we started with 7 with the belt, with the Magna Heel version 2. It went to 1. That's not bad actually. Usually when it goes down like this, you will need to wear it for like a few hours, and typically is enough for mild
Yeah.
inflammation. So do the other motion, do the anything to try to aggravate it.
Yeah. Yeah, it's only when I do that.
You do that, and it's 1 out of
Yeah.
10. Yeah. Okay. All right, Carlos. Today is your second visit. We had the first visit 2 weeks ago.
Yes.
Okay. Can you give me update? How do you feel after the first treatment?
After first treatment, I got the tools and I was doing the treatment on my own.
Mm-hmm.
Several days later, I returned to the gym and
Mm-hmm.
I was able to do like pulling,
Mm-hmm.
lifting weights,
Mm-hmm.
with almost no
No pain.
pain.
No pain.
Yeah.
Okay. So you had no pain from the first treatment, and you on your own worked on breaking the scar tissue to make sure that totally is disappearing. Is that correct?
Correct.
Okay. So for the last 2 weeks, any flare up or everything is okay?
About several weeks after that, I did try the pull-ups again, and I think that put a lot of weight on it and
Okay.
pressure. So I did feel some pain after a couple sets,
Mm-hmm.
and I think it was.
How much pain did you feel it?
Um, I would say like a
Mm-hmm.
3 or 4.
Okay.
I was doing them right after.
Okay, so right after that, did your pain linger or your pain disappeared? What happened?
Um, it lingered for a few days.
Okay.
Yeah.
Okay. Do you have any pain now?
No, it's like probably like a 1 when I twisted.
But if you did not have the pull up, you will be okay. Is that correct?
Probably yes.
Okay. So can you give me a feedback, because a lot of patients ask like, is it easy? Is it hard to use the tools? What do you think about you do it on your own at home?
It's easy.
Mm-hmm.
When I was using this tool, I was wondering if I was, doing it correctly.
Mm-hmm.
But
Yeah, but you're able to do it on your own.
yeah.
Yeah, okay. So we'll have you turn this side. Okay. So just 1 out of 10, and that's when you do this motion.
Yeah, and then when I did the pull-ups, it was like somewhere around here.
Did you warm up before the pull-ups?
Yeah.
Okay, probably not ready to do that. You just wanna like wait. And you did 3 sets for the pull-up.
Yeah, I did like 2 or 3 sets of like very little, like 3 or 5 maybe.
Okay, so a couple of things. I prefer to do circuit training. Okay, instead of like doing 3 sets. So do pull up, do something else, go do legs and come back. Just that's better. So you give that time to your muscle actually to recover. So it's not like
Got it. Yeah.
not giving it a break, because majority of the sports injury usually occur either not warming up enough or overtraining.
Mhm.
So not warming up enough, you did not warm up your muscle before you do the activity.
Yeah.
And overtraining, which means you did,
Too many reps.
yeah. Is that painful? It's okay.
That's fine.
hmm So the pain is 1 out of 10, which is really not too bad for second treatment. Okay. And any pain anywhere else, or just?
No. I noticed like the bicep is kind of tight.
hmm And we did the nutrition analysis last time, so, and we did the laboratory testing. So what do you think? What your feedback you had? Like the nutrition evaluation. What do you think?
Yeah, I mean, I came here just for my elbow,
Mhm.
but I think it's great that I did that because, you know, I was
Mhm.
lacking
Mhm.
in some things.
Mhm.
Yeah, if I didn't come, I would probably still been trying to stretch it out.
You're not doing the stretches because I mentioned to him last time. Don't ever do that. You're gonna actually, if you overstretch, you actually could tear the muscle and cause more inflammation. So, and that's will not gonna break the scar tissue. So you have not stretched for 2 weeks.
Yeah, no, I haven't really.
Yeah, and you're feeling better.
Yeah.
Yeah, it's easy to injure yourself if you stretch. Let's turn your arm this way. Sit up nice and tall, suck your stomach. Mhm. You hear that? Oh,
Yeah.
feel this. That's a scar tissue here in this area. You hear the grinding?
Yeah.
Yeah. So when you were working at home using ASTR tools, how much time you used to spend a day?
A few minutes.
Yeah.
Yeah.
Is it um, taking too much of your schedule, or
No.
compare that to stretch? Which one feel like more productive or getting?
Yeah,
out?
definitely using the tools. Yeah.
Yeah, it's easier. Yeah.
The stretching was actually more time consuming.
More time consuming,
Yeah.
but you did not feel any difference with the stretching.
No.
Yeah. Yeah, typically with the patient answer tools, like few minutes a day per body part. That should not be taking a lot of much of your time. You can do it in the morning. If there is inflammation, and part of the tools is a magna heel, you can wear it throughout the day, so you can get treatment while you're doing everything
Yeah.
you do. So 0 to 10,
Yeah, like very, very little feels better.
gone, or still feel it a little bit?
Just a little bit like crazy.
Just as likely a little bit, so he might have a little. So he were fine. My expectation, actually, he re-injured the area when you did the pull-up.
Mhm.
That's probably from overtraining, because you said you did
Mhm.
three sets back to back.
Yeah.
Yeah. So like, my assumption, if you, I will hold on that for 2-3 weeks.
Mhm.
But if you do any exercise, period, does not matter. You have to do circuitry,
Mhm.
especially in the gym. Any weight, do not do it back to back.
Got it.
You know, so this way you decrease your risk of
So
injury.
let the muscle rest for.
Yeah, you know, do you want to do biceps curl for like 15 minutes? What do you think?
Yeah. No.
It's too much. You
Yeah.
know, you're not giving your muscle a break.
Mhm.
But you do biceps curl, you do legs, you coming back.
Mhm.
You know, you give the muscle time to recover. You know. But I like, as long as you warm up and not overtraining, you decrease your risk of having like injuries in the future in those areas.
Mhm.
And the other thing, are you doing the correct format or
Or.
for pull up? Because if
Yeah.
you,
So I make sure I was like, using my back.
yeah, you need to engage your
Yeah.
core first.
Yeah.
Like suck your stomach in before you doing that. You
Mhm.
want to start with a good starting position.
Yeah.
Because if you are like this, I'm gonna come and sit in your elbow. Let's drink some water.
Yeah.
How's that?
Yeah. Better.
Any pain or it's gone?
Yeah. It's almost gone. Just right here a little bit further.
Is it here
Yeah.
and here? Relax. Okay, do it while I'm having the magnet here.
Yeah. I don't feel it now.
You don't feel it. Okay, relax. So he has a little bit inflammation. So we'll have him. This is a new one. Did I show it to you last time?
Yes.
Okay. So when someone has really bad inflammation, let's try it with the Magna Heal 2. You feel it?
Yeah. No. It's good.
It's good. So that's a sign he probably need to use the Magna Heal for half an hour to an hour. It depends on how long to get the inflammation down.
Mhm.
Half an hour to an hour, and you take it off, and you feel no pain, you're done.
Mhm.
You still feel it feel a little bit. Put it on for another half an hour to an hour. You can do it while you walk or standing or any position. Okay. All right. Awesome. So you can look at the camera and just give me feedback about what do you think about the ASTR treatment? This is your second session. We did the nutrition,
Yeah.
and you actually have the tools, and you're working on yourself. So, what would you say to patient or feedback about the
Oh.
approach?
I would definitely recommend it. You know, if it wasn't for that, I would still be trying different things, and it wasn't working out. And you know, I like to be active, so
Yeah, so that will help you to
Yeah.
get back to normal quickly. Yeah,
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 it's great.
that's good. Awesome.
Mhm.
Yeah, thank you.
Thank you.
Thank you. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.